Excedrin Extra Strength is a combination of aspirin, acetaminophen, and caffeine, which helps to relieve pain from muscle aches, toothaches, menstrual cramps, and headaches, including migraines. Aspirin and acetaminophen work by preventing your body from producing certain natural substances that cause pain, while caffeine enhances the effects of aspirin and acetaminophen. The recommended dosage for adults is 2 caplets every 6 hours as needed, with a maximum of 8 caplets in 24 hours. It's best to take it with a full glass of water and with food to minimize stomach upset. Remember to read the label and follow the directions provided. For self-treatment with Excedrin Extra Strength, make sure to read all the directions on the product package before taking the medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth as directed by your doctor, or follow the product package directions. Drink a full glass of water with this medication unless your doctor directs you otherwise. If you are using the tablet form, do not lie down for at least 10 minutes after taking the drug. If upset stomach occurs, you may take it with food or milk. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. Do not use this product for pain lasting longer than 10 days or fever lasting more than 3 days. Use the smallest effective dose. Consult your doctor or pharmacist for more information. If taking this drug as needed, remember that pain medications work best if used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If using this product for headache, get medical help right away if you also have trouble speaking, weakness on one side of the body, sudden vision changes. Before using this product, consult a doctor or pharmacist if you have daily headaches, your first headache after age 50, a headache that is more severe or different from your usual headaches, headaches caused by head injury, coughing or bending, a headache with vomiting, fever and stiff neck. Consult your doctor or pharmacist if your migraine headache is not relieved, or if it worsens after the first dose. If using drugs for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Medication overuse headache. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Consult your doctor if your condition lasts or gets worse. Some common side effects of Excedrin Extra Strength may include nausea, vomiting, stomach upset, trouble falling asleep, or a shaky/nervous feeling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to stop taking this medication and seek immediate medical attention if you experience any serious side effects, such as severe or persistent stomach/abdominal pain, severe dizziness, fainting, vomiting that looks like coffee grounds, black or bloody stools, ringing in the ears, loss of hearing, irregular or fast heartbeat, signs of kidney problems, or easy bruising/bleeding. While it's rare, a very serious allergic reaction to this drug is possible. Seek medical help right away if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's best to contact your doctor or pharmacist for guidance. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Excedrin Extra Strength contains acetaminophen, which can cause serious liver disease if taken in large amounts. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen per day. Those with liver issues and children should take less acetaminophen, and it's important to consult with a doctor or pharmacist to determine a safe dosage. It's crucial to avoid taking any other medications containing acetaminophen without consulting a healthcare professional first, as it is a common ingredient in many over-the-counter and prescription drugs. If you suspect an acetaminophen overdose, seek medical help immediately, even if you feel fine. Symptoms of overdose include nausea, vomiting, loss of appetite, sweating, abdominal pain, fatigue, yellowing of the skin, and dark urine. Additionally, daily alcohol consumption, especially when combined with acetaminophen, can harm the liver. It is best to refrain from alcohol when taking Excedrin Extra Strength. Before taking Excedrin Extra Strength, it's important to talk to your doctor or pharmacist if you have any allergies to aspirin, NSAIDs, salicylates, acetaminophen, or caffeine. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to consult with your pharmacist for more details. It's also important to discuss your medical history with your doctor or pharmacist before using this medication, especially if you have asthma, blood disorders, bleeding or blood clotting problems, ulcers, gout, kidney or liver disease, nasal polyps, anxiety disorders, insomnia, heart disease, high blood pressure, or stomach problems. If you are planning to have surgery or medical procedures, it's crucial to inform your doctor or dentist about your use of this medication and any other products you may be using. Excedrin Extra Strength may cause stomach bleeding, especially when combined with alcohol and tobacco. It's best to avoid alcohol and stop smoking while using this medication. Older adults may be more sensitive to the side effects of this medication, especially stomach/intestinal bleeding and ulcers, liver problems, and trouble falling asleep. Children and teenagers under 18 years old should not use aspirin-containing medications for flu symptoms or chickenpox without consulting a doctor, as it may lead to a serious illness known as Reye syndrome. Women of childbearing age should discuss the benefits and risks of using this medication with their doctor, especially if they are pregnant or planning to become pregnant. This medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It's important to consult your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions with Excedrin Extra Strength. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Excedrin Extra Strength include acetazolamide, cimetidine, corticosteroids, ketoconazole, methotrexate, certain medications for gout, anti-seizure drugs, and vemurafenib. If you have recently received certain live vaccines, consult your doctor before using this product. Excedrin Extra Strength may also increase the risk of bleeding when taken with other drugs that may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to check all prescription and non-prescription medicine labels carefully, as many contain pain relievers/fever reducers. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, continue taking it unless instructed otherwise. Lastly, be aware that Excedrin Extra Strength may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you use this drug. If you or someone else has taken too much Excedrin Extra Strength and is experiencing serious symptoms such as passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach/abdominal pain, extreme tiredness, yellowing of the eyes and skin, ringing in the ears, rapid or shallow breathing, irregular or fast heartbeat, changes in urine output, dark urine, confusion, agitation, seizures, and loss of consciousness. It's important to not share Excedrin Extra Strength with others. If you use this medication regularly or at high doses, your doctor may want to do some lab or medical tests to check your liver and kidney function. Make sure to keep all your medical and lab appointments. Since Excedrin Extra Strength contains caffeine, you should avoid taking it close to bedtime as it may make it difficult for you to fall asleep. It's also a good idea to limit other caffeine-containing medications, foods, or beverages while taking this product to avoid feeling nervous, irritable, or having trouble sleeping. If you're taking Excedrin Extra Strength for headaches, it's best to avoid certain foods that may trigger your headaches. Making lifestyle changes like participating in stress reduction programs, exercising, and changing your diet may help prevent headaches. Be sure to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you are taking Excedrin Extra Strength regularly and happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, then it's best to just skip the missed dose and take your next one at the regular time. Avoid doubling the dose to make up for the missed one. Make sure to store Excedrin Extra Strength at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.